So as Dr. Christian commented, and many of you know, California's Central Valley region is home to over 6 million people, a population that surpasses the size of 10 US states, and whose health indicators, as Dr. Christian commented, rival those of the poorest parts of Appalachia. The 8 counties in the San Joaquin Valley rank among the lowest in California in both health outcomes, including mortality and morbidity, and the factors that contribute to health, social and economic factors, physical environment, and as we've been reminded of most recently, with the air quality from forest fires, exposures to not great air. The San Joaquin Valley is home to more than 4 million rural dwellers, 41% of whom are covered by Medi-Cal. Fresno, Kern, Madera, and Tulare counties rank 52nd, 53rd, 49th, and 50th, respectively, for health outcomes out of California's 58 counties. This means that we have a high proportion of vulnerable people living in persistent poverty, with unstable or uncertain employment and without stable housing. Many of those who do have adequate housing worry about paying rent and mortgages. And these kinds of circumstances drive differential exposure risk across social and at times geographic lines. And such vulnerabilities underlie the escalating COVID-19 crisis in our region. So I'm just showing a couple of graphs. I don't have time to go into them, but I want to give credit to Tim Sheehan from the Fresno Bee for his wonderful coverage of the COVID-19 crisis in our region. But I just want to comment that all of our counties have reported confirmed cases of coronavirus among residents since the first cases were appeared on March 6th. And the over 64,000 cases in the region, including over 800 deaths, are among almost 800,000 cases in California reported as of September 21st. And so these are just other representations to show you that in some of our counties, we have over 20,000 cases. And the number of deaths are also have risen, and in September of this month, not so bad so far, so fingers crossed. And this graph just shows a comparison of Fresno County to the broader valley. So what does this mean in people's lives? Well, as many of you, I'm sure, have heard about the outbreaks associated with Foster Farms meatpacking plant in Livingston and Harris Ranch Beef Company in Selma. These are people's workplaces where their already perilous and dangerous jobs have gotten worse in the context of the pandemic, as supervisors have sped up production lines to compensate for having employees who are out sick. We already know that food processing is an incredibly dangerous line of work, and especially in meat packing, there's an average of 2 amputations occurring weekly. On September 1st, the Foster Farms factory was shut down for deep cleaning after Merced County health officials learned that 8 of its employees had died after contracting the virus, and another 358 had tested positive. In this context of heightened vulnerabilities due to persistent poverty, minimum wage labor, which doesn't allow for work from home, and an epidemic of chronic conditions, including diabetes and hypertension, sheriffs throughout the valley initially refused to enforce the governor's prevention plans. So we have not only challenging health and environmental conditions, but also political resistance to preventive measures. We have a lot of work to do. Combined, these create a context in which COVID-19 is spreading throughout the valley. So I want to close with just a nod to the most recent development, which at the end of August, Gavin Newsom announced, as I'm sure you're all aware, his blueprint for a safer economy, which instituted risk-based criteria on tightening and loosening COVID-19 allowable activities. So these criteria dictate what sectors can operate in each county. Based on data, each county falls into one of 4 colored tiers, and the purple is widespread, red is substantial, orange moderate, etc. As you can see here, the San Joaquin Valley counties are in tier purple for widespread. So Fresno, Kern, Kings, Madera, Merced, San Joaquin, Stanislaus, and Tulare. This is from 9:15. I'm not sure if things have moved since then. But what this shows, everything I've mentioned very quickly here, to me is the importance of collaboratives like HEAL and the work of the webinar presenters you're going to hear from today to address these gaps and to create new possibilities from the ground up that are relevant to and that build upon the expertise, strength, and innovation that we have here in the Valley. Thank you.